Go ahead, ma'am.
So, good afternoon, everyone. This is Dr. Gayatri Satpathy. I am a fertility consultant practicing at Oasis Fertility at Bhubaneswar. In today's discussion, we shall be discussing everything about what you need to know about IVF. So, this is going to be a very useful video for all the couples who are undergoing or are going to plan an IVF cycle. So, without wasting time, we'll start our presentation. So before we actually go into the IVF part, it is important that we understand a bit about how the natural conception happens. So every month for a female, from the ovary, there is a release of one healthy egg, and this process is called as ovulation. And in the process of ovulation, the egg gets released from the ovary and then it enters the fallopian tube. At the same time, when intercourse happens and the sperms are traveling from the vagina, they travel into the fallopian tube. So inside the fallopian tube, the sperm and egg meet, and the fertilization of the egg happens, and the embryo develops inside the fallopian tube. Then, after 3 days of stay inside the fallopian tube, the embryo travels into the uterus, and further pregnancy grows inside the uterus. So, such a complex mechanism for pregnancy is happening inside the fallopian tube. So, all this when it happens outside the human body, then this process is what is called as an in vitro fertilization. So in vitro fertilization, it is also a type of fertility procedure, and it is short for what is called as IVF. So it is a fertility procedure where the egg and the sperm meet outside the fallopian tube, and so they are met, and the fertilization happens outside the human body. So just to brief you why this process, why is it called as in vitro fertilization, or why this name came up, it is because in vitro is a Latin word for glass. So when the first in vitro fertilization happened, the sperm and egg were met together in a glass dish. So this is how the name came up as in vitro fertilization. So this is very short about the history of IVF. So the first IVF procedure happened way back in 1978, and the first baby was born on 25th July 1978. And in the picture, you can see the Mrs. Louise Brown, and she's the first IVF child who was born, and now she's 45 years old. And her mother underwent IVF because both her fallopian tubes were blocked. And the good news is that Louise Brown herself became a mom, and she, however, conceived naturally. So the first IVF was done in the world because of the blocked fallopian tube. So in this slide, I'm just showing you what are the routine reasons for which we perform IVF. So one of the important reason is there is a tubal factor. That is, if one or both the tubes are blocked. The second important cause is when there is a woman who is suffering from endometriosis, because in this condition, most of the times the uterus, the tubes, and the ovaries, they get affected. The third reason is when they have low ovarian reserve, which again could be because of many reasons, such as if she has endometriosis, or there is some genetic cause, or if she is of advanced age. So again, advanced maternal age, especially if they are more than 35 years, so they generally tend to have a low ovarian reserve. So in these women also, we tend to prefer IVF. And those couples who have underwent multiple failed IUI or artificial insemination cycle. So after a number of IUI failures, so then the best treatment now is to go for an IVF. So apart from this, so in this particular slide, I have actually enlisted all the indications for an IVF. So as you can see, the most common is when there are multiple factors. That is, both male and female have some factors together, which is now leading to go for an IVF. The second, again, important factor is when there is a male factor alone. That is, if there is a low sperm count or a very low sperm count where IUI will not help. So then we go for an IVF. Then again, a major part is contributed by an unexplained cause. That is, both male and female have no reason for infertility, and they failed, or they might have failed multiple IUI cycles. So then the best line of treatment is. And then again, multiple factors could be there in female. There could be tubal factor, a diminished ovarian reserve, then ovulatory dysfunction. So this is very common in conditions like PCOS, or if a woman is overweight or she has thyroid problems. So the ovulation is not happening properly. So there again, IVF can help. And endometriosis and uterine factors. So uterine factors could be reasons like if the uterus has been affected with conditions such as tuberculosis or Asherman syndrome, or if there may be some women who do not have a uterus, so they can have their own biological child using IVF. So let's understand the process of IVF or in vitro fertilization. So before the couple actually goes into the process of IVF, it is important that they have a one-to-one discussion with a fertility specialist who will explain them in detail why this procedure was opted for them, what was the cause of infertility for them. The fertility specialist would like to evaluate both the partners before going into the IVF cycle, and would also explain to the couple what are the chances of success and what is the procedure in detail. So the pre-IVF testing is done on both the partner. For a female, we most commonly do the hormone testing. Of the hormones, most important is to do an anti-Mullerian hormone test. Apart from this, we also check for the thyroid hormones, the prolactin hormone, the sugar levels, etc. And the second test is the hysterosalpingogram. Again, this is done only in selective cases. It's not done routinely for all women who are going for an IVF cycle. Then third is to do a genetic analysis. Again, this is done selectively, especially those females who have underwent multiple failed IVF cycle, or who have history of any genetic disease in the family, or if there is any female who has repeated pregnancy losses or miscarriages. So then we would like to do the genetic testing of both the male and the female partner. And then a pelvic ultrasound is done routinely for all the females before she goes into the actual IVF cycle. So in an ultrasound, we try to assess the ovarian reserve. We look at the ovaries, we count the antral follicles, and we also assess this condition of the uterus. For a male, most commonly the pre-IVF testing requires just a semen analysis. However, if the semen analysis is not of very optimum quality, either the count is not good or any other thing is suspected, then sometimes we may have to go for a physical examination, and to supplement it, we may also have to do some hormonal tests for the male partner as well. So the IVF process is actually a series of steps. So these are the different steps which are involved when a couple goes through an IVF cycle. The first step is the ovarian hyperstimulation. The second step is transvaginal oocyte retrieval. Third step is egg and sperm preparation. Fourth step is egg fertilization. Fifth step is embryo culture, and the sixth and the final step is embryo transfer. So let us now go in detail, step by step, and learn what is happening in all these steps. So the step one is ovarian hyperstimulation. Now, why it's called hyperstimulation? Because in IVF, we are basically trying to stimulate the ovaries such that we get maximum number of eggs from both the ovaries. So to get maximum eggs, we have to maximum stimulate, and so the name is hyperstimulation. So what is done is generally from the periods day 2 or day 3, a woman is woman is started on injections. Again, the dose of these injections are decided based on the weight of the woman, what is her ovarian reserve. So generally these injections are given for a period of 10 to 12 days. During the course of these injections, 2 to 3 times scans are done to assess if the right dose is being given and if she is responding or not, or if any titration is required. Now, once the follicles reach a particular size, the next step is that we collect the eggs. But before that, a trigger injection is given, which is the final injection of an IVF cycle. So after this trigger injection, and 34 to 36 hours later, we do this procedure, which is called as egg retrieval or egg collection. Now, this procedure is done under general anesthesia. The procedure generally takes 15 to 30 minutes. And after the procedure, the woman stays in the observation room for 2 to 3 hours. And when she's comfortable, she can go back home. Or the procedure is done vaginally. There is no cut abdominally. So the woman is absolutely fine because she's under general anesthesia or light sedation. And she can go back home the same day. And the third step is the egg and sperm preparation. So once the follicles have been aspirated or once the eggs have been collected, so they are kept in rest in proper medium in the lab for first 3 to 4 hours. Meanwhile, the male partner has given the semen sample. On the same day, we are collecting eggs from the female partner. This semen sample is now processed in the lab. So centrifugation is done and good quality sperms are separated. Then the most important step is step 4, which is a fertilization. Now we have 2 ways of fertilization. One way is called as ICSI, and the second is a classic IVF. So ICSI is short for intracytoplasmic sperm injection, and IVF is the difference is that in IVF we keep each egg along with a particular number of sperms. So the basic idea is that the best sperm is going to be self-selected. So it is going to compete among the rest of the sperm and will itself go inside the egg material and it will fertilize it. But the other way is now, which we also done routinely also, it's called as ICSI. So in this, what happens is the embryologist tries to select the sperm manually. The best looking or the appearing sperm is selected and it is directly injected into the egg with the aim of fertilization. So, however, there are particular cases where actually ICSI is more preferred in comparison to IVF. So, these are cases like when we have severe male infertility. That means that if the count of the sperm in the semen sample is so low, or if the sperm has been collected directly from testis, so in those cases we cannot go for an IVF. So in those cases, because the number of sperms itself very less, so the sperms have to be individually injected into the eggs. The second is if we have oocyte abnormality, particularly if the outer layer of the egg appears very thick, so then it may be difficult for the sperm to penetrate inside the egg. So in those cases also we go for ICSI. Also, if the eggs have been frozen previously, for example, many women nowadays go for egg freezing, social egg freezing. So in these women also the outer layer of the egg generally remains hard. So in these women we prefer ICSI. Then third is woman's age. Most of the times if the mother's age is on the higher side, the quality of the eggs may not be so good. So in those cases also to enhance the chances of fertilization, ICSI is preferred. Then couples in whom we require to do a genetic analysis of the embryo, which is called as pre-implantation genetic testing. So in those cases, it is important that we do an ICSI rather than an IVF. And then there could be couples who have had multiple IVF failure and classic IVF was done for fertilization. So for the next time, we go for an ICSI to increase the chance of fertilization. So the next step is embryo culture. So once fertilization happens, now the embryo is left to grow and a good environment is given within the lab where the temperature, humidity, and the gases are maintained. And the embryos now grow in this well-controlled environment. So by day 3, we check whether how many embryos have formed, and once we check those, again we leave them to grow. Most of the times we keep the embryos to grow till day 5 or day 6 of the development. So the embryos which are able to reach this particular day 5 stage, so these embryos are called blastocysts. And at this stage, we cannot leave them further to grow in the lab because after this stage, the blastocyst embryo requires a mother's uterus to grow further. So this is an example. This is a picture of an incubator which we use in our lab. So the separate dishes are there because each dish is separately labeled with the couple's name and ID, and then the temperature is maintained, humidity, and all the gases are all well maintained in these incubators. Once the embryos are formed, the embryo freezing is done. So the embryo freezing is done within the liquid nitrogen containers at minus 196 degrees. The final step is embryo transfer. So previously, most of the times the embryo transfer used to be done on by using the day 3 embryos. But because now the labs are more advanced and we are able to grow the embryos for a longer time, as I mentioned, most of the times we are now preferring to grow the embryos till day 5 stage. So nowadays we are doing day 5 of blastocyst embryo transfer. Blastocyst embryos have more potential to give pregnancy than a day 3 embryo transfer. And again, embryo transfer could be fresh embryo transfer or they could be frozen embryo transfer. Fresh embryo transfer is when in the same cycle when the egg collection has happened, in the same cycle itself the embryos are placed inside the uterus. But nowadays most of the time again we prefer to do a frozen embryo transfer, where in the same cycle we just freeze all the embryos, and in the next cycle after getting the uterus ready, we transfer the embryos. So embryo transfer procedure is done under ultrasound guidance. So this is a picture where you can see the ultrasound image, and we can see that the catheter which contains the embryos. So this catheter is passed inside the uterus under the guidance of ultrasound. So we exactly know where we are depositing the embryo. So this enhances our success rate. An embryo transfer procedure is not done under anesthesia. It takes hardly 3 to 5 minutes. Without anesthesia, women are comfortably able to undergo the embryo transfer procedure, and they just take a rest of 30 minutes to 1 hour, and then they can go back home the same day. So to understand what is the overall timeline of the IVF treatment from the ovarian stimulation to the embryo transfer, so it generally takes between 4 to 6 weeks. So how do we prepare our body for IVF? So it's very important because if we prepare ourselves well, we can get good results. So most important is that you educate yourself about the IVF process. So you understand, you get good information. Any doubt, you always consult your fertility specialist and be emotionally prepared. And for this, you need support of your partner as well. You get your health checkups done beforehand. You eat a healthy and well balanced diet. You take your vitamins, supplements, and antioxidants as advised by your fertility specialist. You quit smoking and drinking. You avoid caffeine, or at least limit the quantity of caffeine and nicotine. And you take regular sleep, and you don't stress yourself. So for that, you can even practice some deep breathing exercises or yoga in your life. So now let us break a few myths which are surrounding IVF. So as we all know, IVF is now becoming a well accepted and it's a very common fertility procedure that is being offered to the couples. But still, there are a lot of myths which are surrounding IVF. So it is important that we understand those before we are going into this journey of IVF. So one of the very important myth is that IVF is only way to conceive if you are having this problem of infertility. No. So when you are coming to a fertility specialist, so we try to evaluate you, find out the cause, and most of the times even we want you to conceive naturally. So we may give you some medicines and we try IUI. So only these things fail, then the next option is to go for an IVF. So generally, IVF is actually the last option for most of the couples to help them to achieve pregnancy. But yes, there could be some conditions where IVF is the only option. For example, if man has no or low sperm count, if a woman has come with a very low egg reserve, so or if a woman has blocked fallopian tubes which cannot be corrected surgically. So in those conditions, IVF is the only way out. So the second myth is IVF always results in twins or multiples. And yes, this was a thing of the past, but now because of the advancements in the technology and that now we are able to do single embryo transfer, this is single pregnancy is what we are now commonly seeing, and we are very less encountering twin pregnancies. So the third is IVF treatment or medication can increase the risk of your cancer. No, because the medications or the injections that we give you during your IVF process, these are all made with recombinant technology. These are absolutely safe, painless. They do not have any adverse reactions or any allergic reactions. And also there are no studies which have proven that use of these IVF medications or injections increase the risk of your cancer. Then IVF is a very traumatic procedure. This is again a myth because IVF is now a very patient-friendly procedure. Most of the women who come to us are also working, so they don't have to take any break from their work. They can schedule their injection times according to their convenience. They take the injections and go back to their workplace. And even the injections are so fine and thin that there is absolutely no pain, and most of the times the patients are very comfortable. And IVF maybe increases the risk of birth defects. Absolutely no. We are only using the process of IVF to create the embryo. However, it does not increase the risk of birth defect. The small risk of birth defect is there with any kind of pregnancy. Even a spontaneous pregnancy has around 2 to 5% risk of birth defect. The same applies to IVF. In fact, you can actually decrease the risk of birth defects in your pregnancy through IVF if we additionally go for genetic testing of the embryo. Thereby, we know which embryo is genetically healthy, so more or less likely that you are not going to have a birth defect in the baby. Then one IVF failure increases the chance of that you're not going to have pregnancy again. Again, this is not a right thing because just because there is one IVF failure does not mean that there is no hope for any pregnancy. We need to evaluate you a bit more further. We need to do further more tests, find out what is the cause, and if any particular cause has been found, we would like to act accordingly. So in my next slides, I'll actually also highlight this, like how do we manage people who are having a failed IVF cycle? Because there are many couples who have conceived even after 3, 4, 5, even 7 IVF cycles. So the most important thing is that you don't lose hope and always keep trying. And there are a lot of complications in IVF pregnancy. Again, this is a myth. Complication in any pregnancy is because of any pre-existing or any new disease which has started during the pregnancy. So IVF is only a way to achieve pregnancy, but IVF does not lead to any complications in pregnancy. Then again, this is a myth that if you are going for an then definitely it's going to have a 100% success rate. No, because just like any other fertility treatment, IVF also has its own success rate. No doubt that compared to simpler treatments like IUI, IVF has a very high success rate. But most of the time, the success rate is between 40 to 50% for most couples who are less than 35 years. There are many factors which actually contribute to the success of IVF. The most important is the age of the couple, for how long they have been trying, what was the cause of infertility, if there is any background biological, hormonal, or genetic factors which are causing the infertility. Then again, this is a myth. As I mentioned, IVF is always successful. No, it's not a guarantee that it will give you a birth, but then definitely because now IVF has become more advanced and now it's been 45 years into practice and millions of babies have been born worldwide, it's definitely an advanced level of fertility treatment. But then the success of any particular treatment depends on multiple factors. So that's why it's very important that pre-IVF you have a good one-to-one discussion with your fertility specialist and understand what is your success, what is the chances of your success with the IVF program. Then the other myth is IVF leads to hormonal problems later in life. Again, this is a myth because most of the medications which are given, these are all made through recombinant technology. They stay only in the blood for around 24 hours, and after 24 hours, there is no trace of these medication. So long-term problems or any hormonal problems in later life is actually a myth. Then this is again a myth. IVF procedure requires hospitalization. No, because most of the procedures are done on a daycare basis. For example, the egg collection procedure, you go back home the same day. Embryo transfer, you go back home the same day. Rest of the days also, you take the injections and then go back. So it's a daycare procedure totally. Then IVF pregnancy means delivery is only by C-section. Again, that's wrong. What type of delivery you are going to have is only decided towards the end of your pregnancy. So at that time, the doctor checks the baby's growth, the baby's weight, what is the condition of the any other problem is there in the pregnancy or not, and then depending on that, the doctors can decide. Many of the IVF pregnancies are also delivered naturally. Then this is a very common question that is asked, and which people think that they require an absolute bed rest following in the IVF cycle or following embryo transfer. Again, you do not require a complete bed rest. We actually advise against this. We do not want you to take a complete bed rest following embryo transfer because this is actually going to increase the chances of infection and decrease our success rate. The more mobile you are, the more active you are, the more normal lifestyle you lead, the more chances that you are going to have a pregnancy outcome, a positive pregnancy outcome. So what are the positive signs following embryo transfer? So some signs you may have before you are doing the blood test. You may experience some symptoms and which may be a positive thing, which may indicate that you are going to get pregnant. For example, if you are experiencing some nausea or vomiting, if you're experiencing some bloating, or frequently you need to pass urine, or if you missed your periods, or if there is some slight bleeding or spotting, or if there is any breast tenderness or soreness. So these could be some favorable signs that you may get pregnant. But again, these symptoms can also be because of the medications that you are taking post embryo transfer. So it is important that we wait for the number of days that your doctor has advised you, and only when we do a blood test, we can confirm that you are pregnant or not pregnant. So these are the do's and don'ts after embryo transfer. Again, a very most commonly asked question by the couples. So rest. See, only a 30 minutes to maximum 1 hour of rest is more than enough following an embryo transfer, which you have taken in the hospital. Once you go back home, you have to lead a normal life. You do not have to be on any kind of bed rest. So daily activities as usual. You can even go back to your work and do all the normal work what we are doing at home. Yes, but heavy work or lifting heavy objects are not allowed. Then drinking plenty of fluids, keeping yourself hydrated is very important. You take a well-balanced diet. Avoid outside and processed food and any sugary foods during this period. You do not, and for medication-wise, whatever medicines your doctor has advised you to take following the embryo transfer is what you are going to take. Any extra medications, if you have any doubt, always consult a fertility specialist and then take. Avoid immersion baths, particularly avoid hot water baths and sauna because you may land up with infections. So for that, we ask you to avoid them. And we also ask to avoid sexual intercourse. This is only to prevent the infections. So when do you do the pregnancy test? So after the embryo transfer, so most of the times 12 to 14 days or maximum 15 days after the embryo transfer is we ask you to do a blood test which confirms whether you are pregnant or not pregnant. So what do we do with the frozen embryos? This is again a very important question. So the basic idea of doing an IVF and hyperstimulating your ovary is that we have a lot of embryos. Why? Because suppose in your first embryo transfer, the embryo transfer failed and you did not get pregnant. So you can again try for a pregnancy using doing only an embryo transfer. You do not have to start from the from step number one. So we can keep doing embryo transfers alone till you achieve pregnancy. Or if you have achieved a pregnancy and there are extra embryos remaining in the lab, you can use them for getting pregnant a second time or a third time after a gap of few years. The embryos, once frozen, they can stay in the lab in the same condition for months and years together. So there is absolutely nothing to worry about. So what type of food do you eat during and after? So this is around the IVF cycle and also around the embryo transfer. So it is important that you take a well-balanced, healthy diet. You need to ensure that micronutrients, all vitamins, minerals are going inside your body. So food like whole grains and then good fish like salmon, then sweet potato, nuts and berries, grains, avocado, leafy vegetables, and fruits. So these are the things which you need to incorporate in your diet. You need to avoid packaged food, fast food, spicy food, undercooked meat. You need to avoid fish which contains a lot of mercury. For example, the swordfish or mackerel fish, and avoid caffeinated beverages or reduce the amount of nicotine and caffeine, and avoid alcoholic beverages, and avoid foods which you are allergic to. And in short, about exercise and yoga after embryo transfer, yes, you can do mild form of exercises. You can go for walk, and all you can even do those yoga postures and exercises that are safe in pregnancy, like the up. You can concentrate more on your upper body, arm, your legs, and you can do back strengthening exercises. So these are good, but do not avoid do such kind of exercises which are going to put a lot of pressure on your lower belly. And travel after embryo transfer, yes, following embryo transfer, you don't have to be get locked up in your house. You can go out for some time, for like you want to go for a short shopping or you want to go for a movie, you can do that, but be careful on the road bumps. You need to relax. You also need to enjoy this period. However, you can avoid travel using bike or auto. Again, these are the very important questions which are asked to us. So, can I climb stairs following embryo transfer? Yes, because most of the women, they are having, if they have their houses upstairs, so they need to use the stairs so they can slowly walk. And can I use Indian toilet? Yes, because again, Western toilets are not available everywhere. So Indian toilets can be used. Only thing is, while passing stool or urine, you do not have to put a lot of pressure. Can I drink hot water? Yes, you can drink hot water. Can I bath daily? Yes, you need to bath daily actually, because you need to maintain a good hygiene also. Can I bath in hot water? You don't. We do not actually generally advise you to take bath in hot water, and but you can take a head bath, and you. We also advise to not to have sex following the embryo transfer. So, in short, about why IVF fails. As I mentioned, you IVF again is a type of fertility treatment. Any kind of fertility treatment has its own success. So IVF also does not have a 100% success rate. So most commonly why it fails is when there is a poor quality of the eggs or sperm, or if the embryo did not form of a good quality, or if there, for example, if there are lower grade embryos which are formed, there could be any genetic problem in the couple, or if the uterus has any issues, for example, if the lining of the uterus is not forming well, or if there is any uterine malformation. So in such cases, IVF can fail. So what should we do when a couple has come to us with a failed IVF cycle, or if they have failed an IVF cycle with us? We need to evaluate a bit further. We would like to evaluate your uterus, doing a hysteroscopy. We may have to do a endometrial receptivity array so that we know the correct time to place the embryo. We may do additional tests on the sperms like DNA fragmentation test. We may evaluate you genetically more, like we can do a couple karyotyping and sometimes an immunological test. So what are the treatment options for the next IVF cycle? So certain test options we may offer based on your test results. Sometimes we may offer you pre-implantation genetic testing of the embryo. Then advanced techniques or procedures in the lab can be thought about, like assisted hatching of the embryo, or doing an advanced sperm selection like PIXI or MAX. Then we have laser assisted hatching of the embryo and use of embryo glue. And sometimes, if there is repeatedly, we find that the egg quality or the sperm quality is very poor, then maybe we need to go for the third party reproduction options. That is, we may have to go for a donor egg or a donor sperm. And sometimes surrogacy is an option when the uterine factor is a major factor which is not allowing you to go for a pregnancy. So I would like to end today's discussion by asking you all to always stay positive, think positive. Positive thoughts, they have a big impact on on our success rates of any kind of treatment, even the IVF treatment. So I hope this was a very useful discussion, and I'm open for any kind of questions if they're from the viewers. Thank you. Yeah, so please you can display any questions if there are by the viewers. So, do IVF babies look like their parents? Yes, why not? Yeah, definitely. If the because the egg is collected from the woman and the sperm is of her male partner, the babies, if they are conceiving naturally or if they are conceiving IVF, there is no difference. So they will look like their parents only if we are using the egg and sperm from the same couple. But sometimes when we have to take the egg and sperm from a different source, then there can be an issue. But that also, for example, if an egg donor we have selected and we try to match the egg donor with the primary couple as far as possible. So in that cases also, it is the babies many times they do not look much different from the parents. Is IVF safe for the mother and child? Yes, absolutely, it is safe. The Because now IVF has advanced so much, the quality of the injections that are used in IVF have increased so much that there is hardly any allergic reaction. There is hardly any other problems. So it's absolutely safe, and also painless. So patients are very happy, and they do not complain of anything while they are undergoing the IVF procedure. Is IVF painful? No, absolutely not. Even the ovarian hyperstimulation, the 10 to 12 days of injections which are given, they are not painful because the injections are so thin and fine that the patients do not experience any pain. However, because these injections are costly, so it is important that they come and take the injections at the center and get the injections delivered by a well-trained staff nurse. Yeah. So I think these were the questions, and any further questions you can always ask us in the comment section, and we would be happy to answer. Thank you so much.